Welcome, everyone. I'm very excited to be here again for you and with you today. I'm Denise Stiegel. I'm the CEO and curator of Living Healthy List. And we are your one-stop for honest and reliable information on health, wellness, personal development, and some fun. So today I'm really excited. I am joined by Dr. Ryan Harvey. Dr. Harvey is the clinical director of House Call Doctor in Australia. He is also a GP who recently opened a skin cancer clinic called On Point Skincare Clinic. And what I love about this is the focus is on providing, obviously, professional, timely, and affordable skin cancer treatments. The interesting piece when it comes to Dr. Harvey is that's not what he's here to talk to us about today. You know, as a doctor, as a general practitioner who obviously sees men and women, today we are here to talk about something very specific to men, something that affects men only. So, and that topic, of course, is prostate cancer. So, Dr. Harvey, thank you for joining us. Welcome.
Hello. Thanks for having me, Denise.
I'm very excited to have you here. You know, as a woman, prostate cancer really isn't something that I really know a lot about. I obviously know that, you know, men get prostate cancer. I am married to my husband. But other than that, what is prostate cancer?
So prostate cancer worldwide is the second most frequent common cancer that men get, and actually accounts for, in terms of all medical conditions, it causes the fifth most amount of death for men worldwide. So it has got a very large negative effect, sort of health burden on men, and it's really up there as one of the top things that men need to be aware of, and women, in terms of being diagnosed, treated, and managed. So I thought I'll tell you a little bit about what is prostate cancer exactly. So the prostate gland is obviously used for male reproduction. It forms some of the fluid which is in the semen, and it's an active gland, and it has a propensity to form prostate cancer, which is cancer cells or abnormal cells growing outside the normal boundaries of human organs. And prostate cancer, being in the prostate, can sometimes present very benign with no symptoms at all. So this is why there can be such a high level of disease and adverse outcomes as a result of prostate cancer. Most commonly, men who are diagnosed with prostate cancer, it occurs later in life, after 65 years of age. But we generally tell men to start being screened or look out for prostate cancer from about age 50, and even a bit younger, even 45, if you're in a high-risk group, a high-risk ethnic group, or you've previously got family history of prostate cancer in a younger male adult. Now, prostate cancer can present with no symptoms at all, and is sometimes just found through routine testing by your family doctor or general practitioner. And this is usually done through a blood test or an examination. There's a lot of things, that nasty examination that men have to go through, but most times that can be avoided, usually with a blood test, unless there's some symptoms. Now, what symptoms men can have if they present with symptomatic prostate cancer is important to be aware of, and this can be finding it hard to urinate, straining to go to the toilet. We call some of these symptoms retention symptoms, so a feeling of a full bladder, not being able to relieve yourself completely. In later stages, it may present with some blood, either in the urine or the sperm. And it can also, if it presents quite advanced, may present with sort of back pain or aches. Because unfortunately, the cancer can spread early without symptoms, and it can spread most commonly to the bones of the spine. So those are the symptoms we ask men to be aware of, and even if there's any change in their general health, feeling tired, maybe a bit breathless, we want them to get checks. We want men to get regular health checks, and especially when they're approaching that middle age of life, that's when the screening comes into play. And in countries like the United States and Australia, we generally do that around the age of 50, and it involves a blood test, yearly or second yearly, depending on a man's personal history. And I suppose from a female's point of view, or partner's, woman's point of view, to sort of, you can be aware of these type of symptoms as well. If your partner's getting up multiple times at night to go to the toilet, or that it's not themselves, maybe they're a bit tired, then it's also always a good thing to prompt them to get to the doctor, because men typically present less often and later to the doctor, and this unfortunately does lead to certain conditions being diagnosed quite later when they could have been caught earlier.
Mm-hmm. Yeah, that's always that a big challenge. I know with my dad, when my dad was still alive, same thing. He was never sick a day in his life until he was, because he just never went to the doctor. And it really was like, he had to really twist his arm. He had to really be ill. And I don't know if that was a generational thing. I hope that, with all of the information that men and women have today, basically at our fingertips, that men would seek help sooner. You mentioned two things that I have a question on. Is you mentioned high risk groups. Who would be in that group or those groups if there are more than one?
So the people at highest risk are those who've had a first-degree male relative. So this would be a father or a brother who has been diagnosed with the condition, say earlier in life, say under 60 years or under 50 years of age. If you've got a first-degree relative who's had an early diagnosis, then you should really begin screening 10 to 15 years before they were diagnosed. So say if they were diagnosed at 60, you should start screening probably about 45 years of age. And this may be a combination of examination or blood tests. The other higher risk groups, generally in the United States, it is recognised that the African American population has an increased risk of prostate cancer. The reason for that's not clearly understood. Some of it can be genetic, socioeconomic, lifestyle factors. And in Australia, for example, our Indigenous population has higher rates of prostate cancer as well. So there are some ethnic variation across the world in terms of what age group and what type of people get the condition earlier. It is more prevalent in sort of Western countries, higher socioeconomic. There's there's not a lot of evidence as to what people can do to prevent it, but there is some evidence that higher weight, obesity, less active populations have higher rates of prostate cancer. So some of the generic advice is, try to keep your weight down, keep an active lifestyle, eat healthy is really the best thing you can do to prevent prostate cancer at this point in time, and to engage in seeing the doctor and the screening process. And unfortunately, we don't have a perfect screening tool either. So there's still a lot of research that's going on and to create better screening methods, less invasive screening methods, because if you have that first blood test that tests positive, then you really have to go and have quite an invasive biopsy, which carries some risk as well, and some people can have complications. So it's not something that men want to line up and have done. So I'm sure it leads to delay in diagnosis. Yeah.
I can understand that, because that was actually my next question, about the testing, because I have heard, that obviously blood test is one thing, but the more invasive is not any fun. But I guess my question is, you know, because there's still a lot of testing, what about accuracy with blood testing and all that? You know, have they managed to figure that bit out, where you have a blood test and it's negative, it's really negative, or if it's positive, it's pretty much positive?
Yeah, so as with all things in medicine, nothing's 100%. So the best test we have in terms of blood tests is called a prostate-specific antigen, or PSA for short. So unfortunately, there are a lot of what we call false positives. So the blood test will be elevated, but then we go on to perform the biopsy and no cancer is found. Now this is because it measures a protein which enters the bloodstream when there's been, say, irritation or inflammation or destruction of normal prostate cells. Now, other things can cause that besides cancer, like infection of the prostate can cause it. Even if there's been some physical trauma, say bike riding, can cause momentary increases in PSA. So there's a bit of art in the science here as to how to interpret that blood test. So you want to interpret it that in a way so you're not performing invasive biopsies on everyone, but only the people you think have potentially prostate cancer. And unfortunately, the opposite is also true. Very rarely there'll be people who test negative for this, but will go on to have prostate cancer. So the test we have is not perfect, but it most certainly is picking up more positive prostate cancer and leading for men to be treated with it much earlier than if we didn't have the test available. And the test combined with physical examination in people who have got symptoms likely leads to some better outcomes. Again, the physical examination alone can also lead to misdiagnosis, because very small cancers you won't find on a physical examination. So it's really a combination of taking a patient's risk, their history, a blood test examination, and then a doctor who's experienced in this, usually a referral to a urologist, can make a decision as to whether to do a biopsy. Because the natural course of prostate cancer, there's probably a lot of prostate cancer that men live with for decades that don't cause any problems, and then there's a large amount of prostate cancer that moves quite rapidly and leads to people's death. So that's where the research is heading. We're trying to figure out much better tests, which cancers can be left alone, because a lot of men get this in their 80s. And they'll pass away from many other causes before the prostate cancer will ever cause them any problems. So that's sort of what it's looking like in the future. But right now, this is the technology we have available. That's the best treatment. Protocols are given by the doctor or specialist.
I see. I know, you mentioned this a second ago about an enlarged prostate. What does that? Obviously, I know I have an idea what that means, but what can that mean or not mean?
Yeah, so having an enlarged prostate, what we call benign prostatic hypertrophy, it's very common. A lot of men have this as they get older. In fact, most men will have probably a degree of it, but it won't be what we call, pathological or clinically significant. So the prostate is probably the size, as a walnut in size. So I've got 20 cc's, which milliliters, but probably you can visualize walnut better. So it's a round-shaped gland, and it has the urethra. It runs straight through the middle of it. So that's where the urine passes from the bladder. So as it enlarges, it pushes on the tube that's running to the middle. So as that's pushed on, it obviously becomes harder for urine to pass. So the main problem men have with the enlarged prostate is passing urine. So they may have procedures which open up the central urethra, which allows urine to pass more easier. And these are type of operations called TURPs or turbits. Very rarely they may need the prostate removed because it's just too large to allow urine to pass through. But that's a completely benign condition. That's not going to cause anyone to die, but it can cause a lot of quality of life issues. So that's why it can often be treated with surgery or even medication in some circumstances.
Oh, okay.
Yeah, so there's some medication you can give that decreases the size of the prostate tissue. It does this by there's sort of hormonal medication and a non-hormonal one. Hormonal medication can cause other problems as well. So it's sort of weighing that up. What's the best treatment for the specific man?
Mm-hmm. As women, we understand the hormonal treatment piece.
Yeah,
that piece we understand.
Yeah. No, it's a more complex hormonal system.
Yes. So we talked a bit about screening. We talked, prevention is basically, healthy lifestyle. We touched a little bit on treatment, but not so much. So let's talk a little bit about that, because I think that's an important piece for everybody to know. Man, woman, son, daughter. We all need to know what to expect.
Yeah. So let's assume man's been diagnosed with prostate cancer. So the options for treatment are dependent on the type of cancer. So lower grade cancers, which are still what we call confined to the prostate, can be treated most effectively with surgery, which would be what we call a prostatectomy, which is removal of the prostate. Now, traditionally this was done with an open procedure, which was a large cut in your belly, and then you would take the prostate out. But more recently, this is done through laparoscopic or robotic surgery. So in case of prostate cancer, they use a robot essentially, where little ports and instrument arms are inserted into the belly, and a surgeon controls the robot from the other side of the room and removes the prostate, and then reattaches the bladder to the ureter, which is just the where the urine needs to flow through. Because as I explained earlier, you remove the prostate, you're removing that tube that's in the center as well. So you're removing the prostate, attaching the urine system back together so you can go on. The surgery, the biggest aspects with the surgery are the complications which you're trying to avoid, which are urinary incontinence, meaning not able to hold your urine, and sexual and erectile dysfunction. So the nerves which supply the penis run down the sides of the prostate. So the two biggest problems causing urinary problems and erectile problems. So the holy grail in prostate surgery is trying to preserve those two issues. But unfortunately, most men following procedure will experience some degree of problem with those two areas, and often will require months to years of sort of specific rehabilitation to be back somewhere close to where they were prior. And obviously in younger men, this is more of an issue than older men, but it's a very important issue to deal with. Now, in high grade cancers, which are usually found in older people, you have other options such as radiotherapy, either external or what we call brachytherapy, is where you place little beads of radioactive material, and it performs the same way as if you're putting an outside beam on the prostate. So little beads are placed within the prostate, and that causes the destruction of the cancer tissue. the same with both these methods, the same complications you're trying to avoid, which is urinary incontinence and erectile dysfunction. And finally, there's chemotherapy and hormonal therapy for very advanced prostate cancer, which may already be in the patient's bones or lungs, liver, elsewhere, because the prostate cancer cells, a lot of them feed on testosterone. So if you remove the testosterone, you remove the cancer's ability to grow and spread throughout the body. So that obviously has other complications. Removing immense testosterone can cause body changes. They may grow breasts, gynecomastia. They have, decreased libido, erectile dysfunction. Their bone mineral density can get lower, easier fractures. They may be at higher risk of heart disease as a result. So it's not ideal, but it's the only treatment left available when it's spread throughout the body. So it is complex, web of treatment for what degrees of prostate cancer, but most prostate cancer is caught early and treated with an operation, and then it's a matter of just rehabilitation following that.
I think everything you just said was really news to me. I mean, I can understand, shortly after surgery that there'd be some complications, but not to the degree where there needs to be, some, rehabilitation therapy. That's something I think that most women have no idea, and probably most guys, because it's not something you actively think about, especially younger men. And like you say, this is something that can affect men typically, as they're older, but can certainly affect men in their 40s and 50s, 60s. I mean, that's both of those things, are such a big quality of life issue. Think of traveling and just going to work and just, a regular, just living your life. That was something that I really didn't understand.
No, it is a big quality of life issue, and the degree which individual men recover varies greatly. So as I said, some men regain close to full function. Some men, may have to wear pads for the rest of their life at an early age. So it's a huge quality of life issue, and it varies, and that's the alternative for not treating prostate cancer can be, much worse. So it's kind of picking the better of two evils in a lot of aspects. But the modern surgery with robotic surgery, the whole goal of that is to be more precise, so there's less chance of causing injury to those nerves. But it's probably an aspect that most men and women aren't aware of. Is it's not simply just take the prostate out and you're fine the next day.
Right.
It's months of getting urinary function back and sexual function back as well.
Would you say, I know we tend to think of this as something that does happen to older men, but in this day and age, like, what does older even mean?
Well,
as I get older, older men get older too.
That's right. Only as old as you feel. Definition. I mean, people over 65 is who get the most of it, and then that increases. So more people at 75 are getting it than people at 65. More people at 85 are getting it at 75. But generally, the life expectancy, if you said, has increased phenomenally over the last, say, half century, where it's well into the mid 80s in most Western countries. So it's not unusual for people to live to 90 plus.
Right.
So having this condition earlier on at 50 or 60, when potentially you might have another 30 plus years of life ahead of you, is a real issue that needs to be sorted out.
Right, and I think it's really important that we do bring this situation in front of people. But this is something that we all need to know. We all need to discuss. When it with women's health, there are things that is taboo that we don't talk about. And I think when it comes to men's health, I think there's probably more of that. I mean, I know with my dad had colon cancer, And at one time he was complaining to me about how he felt and everything. He was going through chemotherapy. And we went to the doctor that day, and doctor asked him how he was doing. He's like, "Oh, I'm all right." And I looked at him and thought, well, no, you're not. And I think there's a lot of that manliness.
Stoicism.
Yes. So what else, what haven't we touched on that we need to know?
Yeah, I think I think it's important. Men need to obviously take responsibility for their own health care as well, and it's their responsibility. But it wouldn't help if they're getting nudged by their sort of loved ones and relatives as well to go to the doctor. The important thing is, if you're unwell, you've just got to be seen. There's no benefit in sticking it out. Like no benefit at all for any health reason, and trying to live sort of healthier lifestyle in all aspects will improve all aspects of your health. And there's lots of support out there, and the doctors are willing to help with all these type of things as well. And I think the era of toughing it out and just thinking it will get better. If we're going to live longer healthier lives with better quality of life, then really have to engage with the doctor and your health professionals to make sure we're on top of these type of illnesses. And if unfortunately you ever contract one, that it can be treated early and have the best chance of full recovery.
Absolutely. You mentioned something just a second ago. You mentioned support. Obviously, support of family, support of your doctor and medical provider. But what other types of support is available for men who are going through, issues with prostate cancer and those kind of challenges that come along with that?
Yeah, that's right. I know in Australia there's very well developed support networks for conditions such as breast cancer, and I'm sure it's the same in the United States. So we have sort of big pink days, and it's very open. October. And October, yeah, and there's large areas of support network with past people who've had it, women who've had it. In prostate cancer, which is essentially the equivalent to breast cancer in terms of prevalence and morbidity outcome, that type of thing. Those networks are, I'd say, probably less developed, and it's probably because they're developing. They're probably men are less active to probably create these formal networks and that type of situation. But there are prostate and men's health groups that exist, which men can access, and survivor groups, etc. And there is, as with say breast cancer nurses, there are prostate cancer nurses who can be accessed, following treatment to help out with those complications. Like you say in breast cancer, it might be lymphedema, swelling in the arms, or acidic look, and that type of thing. With men, I said it's urinary incontinence and erectile dysfunction. That's what prostate cancer nurses deal with. Help giving real life advice for how to manage the incontinence and erectile issues. So they do exist. They're probably just not as publicised. We don't have. I don't think there's a month in Australia for prostate cancer and that type of thing. But that stuff's it's definitely growing. There's definitely a men's health type awareness, which only needs to get bigger and bigger, because unfortunately men do die earlier than women, partly probably genetic, and could partly because of a reluctance to access healthcare. So the more publicity, the more awareness out there, I think could only lead to sort of better outcomes.
And that's what we're looking for, those better outcomes, having the information, knowledge is power. And I hope that, just with our interview here, that, that we teach people what they need to know so they can be supportive and they can help anyone in their family and people that they know to be a good support system, and to help nudge the men that we in our lives to get to the doctor when things aren't quite right.
That's right.
Lovely. Dr. Harvey, thank you for taking the time. I know it's early there in Australia. I appreciate the time and the information. We will, this will be going live, well, not completely live, but this will go live on our website, on our Facebook page, and hopefully we will get a lot of information out there to the people, and I appreciate that.
It's not a problem. My pleasure, and thanks for the chat today.
Absolutely. You have a great day.
Yeah, you too. Cheers.
Thank you.